This is a solutions-oriented day, and it's cool to see people who have actually started startups in really tough environments and markets and are making them work and making them scale. And that's what we've got for you right now is another solution, another initiative, some real action that we want to bring to all of you in another announcement, as Michael said, that you'll be reading about on Devex shortly. With apologies to all of the groups here who decided to give yourselves like 5-syllable names with no vowels, I love this next group, Malaria No More, because it's really clear what they do. So I'd like to invite in Martin Edlund, who's the CEO of Malaria No More, and Anya Ahern, who's the Managing Director of DataBlick LLC, and Lauren Wall, the Senior Program Officer at Path, to come join me on stage. You can hear a little more about this announcement, which is clearly about malaria, at least in part. Go ahead and have a seat.
Thanks, Raj.
So, last week it was t-shirt weather in Antarctica. A little scary. Climate is shifting quickly. It's easy to feel like it's a totally hopeless situation. There's nothing we can do, and there's obviously a lot of health impacts from it. You've got a big announcement around weather data and mosquito-borne illnesses that connects to climate. So maybe we can just dive in, and Martin, tell us what is the announcement?
Sure. Well, thanks, Raj, and thanks so much for having us here. It's been a fantastic day so far, and I would say not only relevant to what we're talking about, there was actually a moment this morning when Naveen from Rockefeller was up here and started talking about a farmer and his weather app and a health worker. I thought he was going to steal our thunder and actually announce something along the same lines. So as you mentioned, there's a lot of energy and a lot of concern about this intersection between climate and health. It's something that Dr. Tedros at the WHO has done a great job of positioning, climate as a health issue. Estimated 7 million lives are lost each year to, directly to climate-related causes. We're focused on a subset of that, mosquito-borne disease, which is incredibly climate sensitive, as we all know. Half the world is at risk of mosquito-borne diseases like malaria, dengue, chikungunya, Zika, and yellow fever. It's as predictable as the rains, that people experience these things.
And it is because, sorry to interrupt, but it is because of the rains in part that it is a very climate sensitive issue,
absolutely,
right? And
absolutely.
Different elevations now are seeing mosquitoes that didn't see them before. Yep. Areas are getting more rainfall than they used to.
So new latitudes, new altitudes, you have an increasing frequency and severity of extreme weather events, which disrupts health systems, so lots of ways that this impacts. And as we started to look at this problem, we saw a lot of people out there thinking about the risks and thinking about how to mitigate these things. We saw an opportunity to turn this obstacle into an opportunity and to actually harness weather data to not just kind of mitigate risks, as we said, but actually to accelerate progress against mosquito-borne disease. And so we're excited today to be announcing, as you're reading behind us now, Forecasting Healthy Futures, which is a new initiative convened by Malaria No More, but with many great partners that's using weather data to combat mosquito-borne disease. And so what I want to do is talk really quickly about the partners, because it's a big theme of today is kind of strange bedfellows, unusual partnerships, and I think we have one here, and it's a real strength. And then very briefly, what we hope to do with this initiative. So first of all, we have fantastic health partners, some of the most innovative health partners in the space, in partners like Path, like the Institute for Health Metrics and Evaluation, working with Malaria No More. But what really makes this special is that we have partners from other sectors. We have partners like the Crown Prince Court of Abu Dhabi. The Crown Prince Court has a long history of working in disease elimination, but they've also helped to convene this. It was at the Reaching the Last Mile forum that many of these partners first sat around a table together and talked about these issues. We have exciting data and technology partners. The IBM-owned weather company is a collaborator in this effort. You may not know it, but the weather company does about 25 billion unique weather forecasts every day. So virtually anywhere that you're seeing weather on your iPhone, on your desktop, it's coming from the weather company. And so bringing that sophistication of data, that granularity of data to this issue. We have partners like Tableau, one of the best-in-class partners for data visualization. They're bringing financing to this. They're bringing their technology, licenses, training. They're making available what they call Tableau Zen Masters, like Anya here, who can provide technical assistance and really help not just those of us here talking about this, but our partners in countries to figure out how to use these technologies to make an impact. So what do we hope that this partnership can do? 5 things, very quickly. One, we want to use hyper-local weather data to equip program managers and frontline health workers to time and target their interventions to have maximum impact. We think we can use predictive analytics. We think we can identify where you're going to see the next outbreak in malaria or dengue or chikungunya and anticipate and address it. Secondly, it doesn't stop with frontline ASHAs and health workers. We ultimately want to communicate to the people that are at risk of these diseases, so that in the same way that my weather app tells me that in 12 minutes there are going to be rains, that I'm entering into an area where there's a dengue or a chikungunya outbreak, or I'm at a real risk, heightened risk of malaria, so make sure my family's sleeping under a bed net. Thirdly, we want to shape the policy conversation. We think the solutions at the intersection of climate and health are going to come through data-driven, technology-driven solutions. So how can this be an example? How can this shape the conversation for others who are thinking about this? Fourth, we want to think about scale from the beginning. We heard earlier today that there's a rampant case of pilotitis going on. Too many small-scale efforts that even if they work, don't have a path to scale. So we have collaborators like the US President's Malaria Initiative looking over our shoulder, helping us to design this from the start, so that if and when we demonstrate that weather data can be transformative, we're in a position to work with them to scale to 27 countries across sub-Saharan Africa and Southeast Asia. And lastly, and this is really kind of the call to action to those of you in the room and those who may be listening, we want to invite partners in. You're seeing a set of logos up there. This core group of partners. This isn't even the beta, this is the alpha, right? We are just getting started in this. And we wanted to put it out into the world at this early stage because we want to invite partners who have technologies, who have lessons, who are working in geographies where this would be relevant to collaborate with us.
There's a lot there I want to dig into, but just on this question of partnership, maybe I can bring you into it, Lauren, because you're running large-scale health initiatives, especially in the digital space. Why is it important that you have these partners when you're dealing with a digitally oriented health challenge like this versus maybe people here in the audience or watching this in the live stream who say, hey, I'm in a very significant technology company. I'm just going to do this myself. I'm going to contract out. I can find a solution on my own. Why is the partnership model so critical to something like this?
Yeah, great question. I'd love to see just a brief show of hands here who's had a successful project without partnerships. Exactly the answer I was looking for. Thank you all so much. These partnerships have been really effective. Path has been building these kinds of partnerships for about 40 years to really affect all aspects of creating this data use culture. We know it's not just enough to hand someone a dashboard that's been developed in Seattle or San Francisco. There are other elements that have to happen to make sure that the data is available through these novel partnerships, like incorporating weather data through amazing tech stacks that partners like Tableau can contribute. But they also need partnerships deeply with the Ministry of Health. As Dr. Florence was speaking about this morning, they can't be just drive-by meet and greets. But we know from our experience that there are deep partnerships with the ministry and that the ministry is one of our key partners in driving these use cases, identifying the main pain points that they're experiencing and really shaping these.
Maybe we can give the example of Odisha state in India and how they use this, because that is a good example, I think, of local government looking at weather data and saying, we're going to change the way we operate and having real impact.
Yeah, so what we're talking about here is not just theoretical. We're seeing some profound examples of timing and targeting based on weather to have impact. So Malaria No More is working in Odisha state in East India. a few years ago, Odisha was the highest burden malaria state in the entire country. It has 3 or 4% of the land mass and population, but it was 30 to 40% of the malaria burden nationally. And then Odisha came up with a brilliant hack. I don't know that they use that language, but here in San Francisco, we'll call it a hack. Traditionally what happened is you wait for the monsoons to come. The rains come, mosquito breeding sites everywhere, roads wash out, communities are isolated, everybody gets malaria. So they had the insight, what if instead of waiting for the rains, we went into the communities where the data tells us this is going to start, and we did population level screening and treatment. So using a 30-cent rapid diagnostic test to identify people who have the parasite, treat them on the spot, and essentially get rid of the parasite before the rains and the mosquitoes come. That simple intervention, combined with standard stuff like bed nets and ASHA workers with testing and treatment, but that intervention has led to more than an 80% reduction in malaria cases in what was formerly the highest burden state in India. It's now dropped to 4th or 5th on the list.
And I know in other examples around the world, Tableau software has been critical because you might have that data, but then you've got to be able to visualize it for the people who have to be able to make these decisions, including at the local level. And you run a data visualization company. We know the power of Tableau. We use it ourselves at Devex to demonstrate and visualize funding data. But this is often for community health workers or health ministry officials. Where does it fit in to this partnership, Anya?
So having worked with the Tableau Foundation on several different projects, including for PATH, for Visualize No Malaria, we actually spend a lot of time going out to the field to talk to the health workers and the people that are running the facilities. And as Lauren had mentioned, we can come up with fabulous geospatial visualizations that we think are, spectacular and cutting edge in San Francisco. And when we show up to the field, they don't even have a smartphone, right? So really going and listening and having empathy for the day-to-day tasks that these health workers engage in, and asking what are useful tools that can help you get your job done more efficiently. And so looking at things like the weather data, and I've been fortunate enough to work with the weather company on other projects like Bridges to Prosperity, where we analyze weather data to inform operations and logistics, looking at building models that incorporate not just the weather data and analytic capabilities, but things like topography and geospatial data to understand the likeliness of water to pool, and then mashing that up with the prediction of rain to really see where the mosquitoes are likely to develop and where those are relative to population, and then providing those health workers with those tools to understand where they need to go to be most effective. So it's been really successful for things like Visualize No Malaria, and so I'm excited to bring the weather in and really see what we can do.
Yeah, and especially in an era where weather is changing so quickly, where you can't just say, well, let's look at what last year's season was and the year before that, and we can model based on that. We don't really know what the models are going to be like in the future years. We need to be able to iterate and move very quickly.
Absolutely, and there are at a high level, three ways that changes in weather patterns really affect mosquito-borne disease. One is subtle changes in the timing and intensity of rainfall, humidity, temperature affects not only mosquito breeding, but actually affects the evolution of the parasite or virus that's being transmitted. So that has a big impact. Secondly, severe weather events like Cyclone Fani that hit Odisha last year absolutely disrupts health systems. And you see cholera, malaria kind of spike up in the wake of these things. But it also affects human mobility, right? When you have these severe weather events, it pushes people out of their home communities. And when that happens, they may bring viruses and parasites with them. And we talk about the mosquito as the vector for malaria, but mosquitoes live within a 1 kilometer by 1 kilometer box. It's people moving from place to place that bring these diseases to new communities. I saw an incredible statistic that it took 300 years for the first 3 mosquito-borne diseases to move from Africa to the Americas. In the last 16 years, we've had 3 novel mosquito-borne diseases move from one part of the world to another and affect hundreds of millions of people.
Yeah, and malaria is one of these ancient diseases that is really complicated and challenging to address anyway.
Right.
You add the climate dimension on top, it becomes even more complex, but we do have the new tools. And that's part of kind of the hopeful message we're hoping to take out of today is if we can actually apply those new tools and find the new models, maybe there's something we can really do with this. Now, what do you want to say to those who are here today who might be working in something tangential to this or somewhere connected, maybe different geographies than where all these organizations work now? How might they actually get engaged in a way that would support this initiative going forward?
So I'll start, and please jump in. You know, we have a great core group, but there's a lot more that we need for this to realize this vision that we've talked about. For one thing, we need to work with mobile partners. We need to work with social partners. We had fantastic conversations with the Facebook team yesterday about, you know, we're bringing a weather dimension to this. What if we could bring a social dimension to this? How would that transform the fight against mosquito-borne disease? We want to work with partners who are in other geographies where these are relevant challenges. And if you are listening to this and you have an idea for how weather data could transform how you're doing your campaigns, come and find us. Let us know. Let's figure that out. And we have absolutely no monopoly on good ideas. There may be other data sets that we're not thinking about that would really influence this. So if you have that knowledge, if you have those ideas, if you're working on those kind of projects, forecasting healthy futures, it's a big cloud. We can all work in it. So please come and join us.
Any other thoughts on this, Lauren?
Yeah, I think that the opportunity for tech partners is huge. Everything from different data sets to enabling data exchange, interoperability, but then there are still the human parts too. So we've already touched on the Ministry of Health partnerships, but other local champions that need to be built to be these users of data, building the types of local champions and data use champions that Anya was talking about to be able to act on this data. I think is another powerful part. So if you're working on organizational processes to enable data for action, or if you're working on individual behavior chains to promote data use, then there's a place for you in forecasting healthy futures.
Any final thoughts from you, Anya?
Yeah, so looking at the Tableau Foundation with the Visualize No Malaria project, it initially just started with Tableau and PATH. And as I mentioned, we found these health workers, well, they needed access to things on SMS. That was their form factor for a dashboard. And so we reached out to Twilio, and they suddenly donated the SMS service. And then as we started to scale, I was doing a Talk at a Women in Data conference, and a woman that works for a high-speed in-memory database approached and said they wanted to help. And suddenly we had immense processing power that would enable us to be able to do these predictive models and really crunch the data needed. And then it just kept expanding where we wanted to be able to automate these processes so we could scale them up to other countries. And we ended up getting support from a company called Alteryx that provides like these automated ETL solutions. So I don't think, those are not names that you might traditionally associate with things like healthcare data, and yet they all made the project be able to just scale and grow and be that much more effective. So there's just a place for everyone to come and help, I think.
And ultimately, and this is one of your points, Martin, which I think is maybe a common theme we've heard today, ultimately getting down to the level of the patient, of the end user, of the consumer, and saying, how does this affect that person's life, and how do we put tools in their hands? Right. And that is a very Silicon Valley way of thinking that can actually be transformative in an industry that is often very top-down or very bureaucratic, to say, hey, this is data. If we get it to people themselves, they might be able to really change their own behavior and change their own lives. So I know there's many organizations here who are working at that customer level, at that patient level, and maybe there are opportunities to connect to an initiative like this because of that.
Yeah, definitely.
Well, please join me in thanking Martin, Anya, and Lauren, and congratulating them on this exciting announcement. Thank you.
Thank you, Russ.